Hi everybody. Welcome to what is the third of these webinars, which we've organised as part of the new, or relatively new, hub for people like us for public health communicators. So I'm Russell Cartwright. I'm a behaviour change specialist with over 23 years experience in-house in senior leadership roles in the NHS. I'm currently working part-time at South East London ICB, and the public health campaigns that I've led over the past few years have won several kind of national and global awards due to their impact. But more importantly than that, I've learned a heck of a lot over the last few years, and I'm really keen to share some of my learning from recent years. And I set up this public health comms hub with support from Can Digital to enable us all to share best practice and learning, and to, as a place where we might bounce ideas and come together and try and increase their impact really. John Paul, would you like to introduce yourself?
Hello, yes, I'm John Paul from Can, and we help lots of public health communications professionals run campaigns that deliver measurable, low-cost results.
Thanks, JP. Okay, so what I would say is please do, if you've got any questions while we're speaking, any thoughts, any ideas, put them into the chat. If you've got any ideas for topics that you'd like to see covered in a future session, a future webinar like this, again, put it in the chat, and we'll have a look at it and see what we can do. Okay, so today's session is all about winter. John Paul, could you move the slides on for me, please? Winter's always been a huge challenge in my 23 years working in the NHS. It's difficult. There's the weather and the impact the weather has on people. This year in particular has been a real challenge. There are lots of variables and things that we can't change or influence with communications. But also this year has been particularly one of the most challenging because there have been high levels of COVID, flu, norovirus, and other seasonal illnesses, which have really affected both demand on services and also staffing in both health and social care. For instance, in what they class as week 9 of winter, which was the 22nd to the 28th of January, the data showed that there was an increase of 78% in terms of bed occupancy by flu patients from last year, the same week last year. So that's massive. Similarly, during that week, there were more than 90,000 patients who arrived at hospitals by ambulance, and bed occupancy, was up at almost 95%. This year, on top of that, we've also had the industrial action during the junior doctor strike in the first week of January. 57% of medically fit patients remained in hospital each day, and that was really due to capacity to with lack of doctors in the system and capacity within social care. And on top of that, there's a lot of staff working in both health and social care who are burnt out. They've gone through a really rough last 3 or 4 years. Recruitment is challenging in both. There's a massive backlog of surgeries, which again, increases some of the pressure. And people are struggling to access primary care services and other services. And that isn't helped sometimes by the quite common perception that you can't get a GP appointment. And some of the research I did, we found lots of people were saying that without even trying. So sometimes it's reality. I'm not saying it's never reality, but also sometimes the perception and the media stories and things like that about some of these topics really don't help. We know, and I guess where the brunt of that pressure is usually seen is at A&E, where where people typically do turn up. So there's a number of behavioural barriers and a number of kind of complexities around winter that we've been trying to overcome. Last winter, I led a campaign that ran in South East London, which where we focused quite a lot on accessing the right service, which will be something that I'm sure lots of you have all done stuff about over the years, and similarly awareness of primary care services. And in the research that we did around that work, we identified these barriers. So something what we call status quo bias. Patients who are used to seeing their doctors in person are still, they may have got a little bit used to not seeing their doctors by during the pandemic, but there is still hesitation. There is still, resistance to virtual appointments. There's also resistance to seeing alternative professionals. So, within most GP practices now, there are lots and lots of different professionals working, but still we do know that there are lots of people who are resistant or want to see their doctor and want to see their doctor in person. Then you have something called present bias, which is where patients are really kind of inclined to access services to get immediate answers or almost immediate answers. So they're not keen to wait on the phone. They're not, they don't. We know that lots of people don't like filling in complicated e-consult forms, and these things drive people to go to A&E, where they might have to wait, and they might have to wait a long time, but they're fairly confident they'll get answers the same day. Then you have decision fatigue. So patients may end up choosing to go to urgent care or A&E after they've spent the whole day bouncing around the system in different ways. They've phoned NHS 111 and waited there, or they phoned their GP practice and struggled to get an appointment, tried filling in an e-consult form and not had any joy with that, or not, and then eventually they just give up and go to A&E. And also on top of that, I think there is definitely an element of information overload. So there are so many different health service options that people get presented with that, these options aren't always clear, and the right decisions aren't always clear. I do also think there is, I mentioned that we've been talking about this and trying to overcome this for decades. There is a little bit of people being blind to the messaging. Our messaging has been quite similar, particularly around the in the right service for quite a long time. So I mentioned lots of variables that can make it difficult to measure in terms of how our communications are impacting some of the pressures in health and social care. But we do know that taking a behavioural science-led approach can change people's behaviours, particularly when it comes to public health. We've seen that in other areas. But what I think is really key and really important here with these sorts of campaigns is that this takes good planning. It's not something you can just turn on and do tomorrow or next week. And to change these behaviours, it can be a real slow burner. You invest your time and effort and money to see the results perhaps quite a bit further down the line. Which doesn't quite work with the reality that, which we're going to see in a minute when we look at the slides from the survey, but funding often comes late or not at all for winter. So next slide, please, John Paul. So thank you thanks very much to those of you who filled in our survey. We're going to go through some of the results around that, but people haven't seen it. We did a short winter survey asking a few key questions. We're going to post the link in chat if you haven't filled it in. Please still do it. We're going to keep this open for a little bit of time because actually we'd quite like to We'd like to use it to get it to a level where we've had a higher response, a slightly higher response, so that we've got enough information to use it to try and use it as a bit of leverage locally for something you might be able to use in your discussions with senior leaders in your organisations to help plan for winter next year, basically. So yeah, we so far we've got 19 responses. It's almost 50-50 split between local authorities and NHS ICBs and one provider trust. Next slide, please. So the first question was around when was your budget confirmed for winter communications? And you can see here that for a lot of the people who responded, no budget at all was allocated. Now, most of those responses were in local authorities. So it does seem that particularly winter pressure funding is more of an NHS thing and an NHS priority. But I'm sure lots of local authorities will still have been doing things like, warm rooms and that sort of thing, as well as the cost of living stuff, particularly over winter. So maybe it's just described a little bit differently in local authorities. But so out of those who were allocated a budget, a few lucky people had that allocated in sort of March and April. July and August, again, that's a good lead-in time to plan for winter. But then the majority had their budgets confirmed in September and October, which I would argue quite strongly isn't enough time really to plan effectively. So then we asked the question, when would you like your budget to be confirmed? And you can see a clear difference there in the results. So people would like it. The majority of people would like it either March, April, or May or June. Probably a lot of those who've had it even later would like it in July and August. But people want their budgets confirmed earlier. So yeah, that's. If we move on, please. Then we asked how joined up public health communications have been this winter, and the good news with this was that nobody so far has chosen not joined up at all, which is really good. You can't actually fully read that on this slide, so apologies. I'm going to tell you what this says now. Hang on, so one sec. So 9 people said selected some sharing of messages, and that's 45%. 7 people said coordination of messaging across the local authority and the ICB, and 4 people selected coordinated messages and activities shared by all health and care partners. So there's some good positive stories there, I think, in terms of how things have been joined up, and I think I guess the next step could be working even more closely and potentially looking at possibly pooling activities, planning together, sharing budgets potentially could be a way of increasing impact further. Next slide, please. So then we asked what were the main areas of focus for winter comms. Not going to read all of these, but you can see the one that probably a lot of us have worked on, which is winter vaccinations, using the right service, industrial actions up there, and then you've got access to services and the cost of living fuel stuff. Yeah, so no huge surprises there. Next slide, please. Apologies, this is a little difficult to read, but this was asking what worked well this winter. So building on the previous slide, there's a few comments around kind of coordination across partners being good. Signposting, some said worked well. Paying for, so boosting organic social media and paying for advertising. Making use of our partners, cascading messages, that came through. Cost of living campaigns. Yeah, there's a few different things in there. One person has listed an increase of activity across their social media. It'd be interesting to know what they mean by that, whether activity is posting stuff or actually getting, reach and engagement. But yeah, next slide, please. Let me ask what didn't work so well. So there's something around, so negative comments around the industrial action that I'm sure lots of us saw that over time. We've got things like, flooding came up actually, and which I know in some areas has been a big issue this winter, as it often is. Native reach, so organic posts on Facebook, that hasn't particularly worked for lots of people, and I can see why that would be the case. Confusion around cold weather alerts, budget allocations or lack of budget allocation, or budget coming in late is a clear trend. That's in there 4 or 5 or 6 times actually. So next one, please. So then we asked, what one thing have you learned this winter to help with planning for next? So there's one particularly around engagement with the public, seasonal timetable and planning ahead. Again, why we need our budgets identified early, involving clinicians, planning again, coordination, preventative comms, in both public health, in local authorities and in the NHS, we always talk about prevention being one of our biggest priorities, but actually we often end up reacting too much, and it's really hard to be strategic in terms of how we plan ahead and make real impact in terms of lots of the areas where we know prevention will make impact, because it's that slow burner. You don't see the results until much further down the line. So some people had valuable insight from communities. Again, it would be good to think about how we might share some of that, amongst organisations, and planning again, evaluation. Yeah, that's the gist of that one. So if we could move on, please. So we've talked quite a lot around planning and funding, and I've been there myself in many times over the years, and I'm not going to kind of draw on particular examples, but it's difficult to plan and to have impact when your budget gets confirmed right at the last minute, and you don't, and you almost plan to do stuff with no budget, and then often all of a sudden a budget materializes and you're running around looking at how you might spend it and how you might spend it to have some impact. So I wonder whether we can use this conversation today and the results of the survey, and like I said, hopefully we'll get a few more in, to think about how, as a behaviour change geek that I am, how we might use what we've learned and what we've got to try and change the behaviours of our senior leaders. And I've put on this slide, a target behaviour where we could, to try and change that. So what we really want is senior leaders and integrated care systems to agree the funding for next year by July, say, would be really helpful. This would enable us to plan properly, to implement in a way that we're really kind of maximising our impact, to test our messaging, make sure it resonates with our audiences, and to develop effective comm strategies and tactics. So what I'd like to do is, I think, to be able to do that and to do that effectively, what you want to do is try and drill down into the problem a little bit more, and do what we call a behavioural diagnosis. So to fully understand what stops that happening now, Why don't we get our budgets early? Why don't we, know what our priorities are for winter early? Because, winter comes around every year and the problems are generally the same every year, with a few variants. Some winters are colder than others. Some winters you might have things like industrial action. But, the problems are pretty much the same. So it would be really good if, I'm asking you to do a little bit of work now and asking you to put some barriers in the chat for us. So what stops that happening, that target behaviour happening in your organisations? So yeah, please do that now in chat for us. I'm gonna while people are doing that, I'll maybe get us going. That was the first one I was going to say. Thank you, Rupali. I think data is a real issue, and that I think is in lots of ways. It's baseline data. Sometimes it's about being able to evaluate. It can be, we talk about all those different variables. There are so many different things that impact whether or not somebody turns up to A&E, for instance, or not. And it is really hard to measure whether your whether your communications intervention has actually impacted on people's behaviour. That's not to say it's not possible, but it's difficult. So yeah, data is another one. Evaluation, I think. This is not no criticism of anyone in particular, but and I've been guilty of it. Quite often we don't get much in the way of budget all year round working in public sector, public health, communications. It happens. If we're lucky, a few times a year, we're allocated a budget to do something, and nobody particularly wants to say that budget or the way we used that budget didn't work, or didn't quite have the impact we hoped it would. But that doesn't help solve the problem. When you don't get money very often, it's difficult to go and say actually we didn't achieve what we wanted. But actually, what I think we need to be much better at is that evaluation, and saying, okay, it worked to a certain extent if that's the case, or these things worked, these things didn't. But actually, if we'd have had a budget earlier, we'd have been able to plan effectively and maximize that impact. I think we need to be a little bit more open around. And there are issues. Nobody wants to put formal reports together which could be construed by members of the public as a waste of money, or that kind of thing. But I do think there is something around, this is actually about making better use of public money. So yeah, I think there is definitely something around evaluation. So I'm just looking at what's in chat. So if we can have a bullet on data, if we can add one on evaluation, or lack of evaluation, conflicting priorities. Yeah, that's always an issue, and yeah, lots of different things come in different times, and often don't even align. They conflict each other in terms of your time, but also in terms of the messaging. So yeah, that's a good one. Other priorities taking over. Yeah. Just late messaging. Yeah. Again, we've all been waiting for potential messaging to come from national, regional, or even locally. And when you're not quite sure what your priorities or what your messaging is, it is difficult to then plan ahead, and especially if you want to do things to maximize impact, like testing or or others. So Yeah, collaboration, or lack of collaboration, and certainly lack of shared budget. I think collaboration. I think we all do collaborate, but often if you're not careful, it can just be, we've done this in our organisation, can you help share it? Whereas actually to collaborate fully, it would be, solving the problems together, planning together, and really, like you say, putting money together and properly working together on solving the problems, I guess. Too many messages, yeah. Vaccines, cost of living, where to go, yeah. Yeah, and I think that is a definite trying to do too much with a small budget. And we are very guilty of that in the public sector. All of a sudden the budget gets identified for something, and if you're not careful, everybody wants a piece of it, and you try and do absolutely everything with that small amount of money and achieve very little, because actually we know that doesn't work. So yeah, totally agree with that. Restrictions in targeting audiences, when expectations and budget have been sent over very last minute. Yeah, again, that's something you can do much easier with more lead-in time, definitely. Yeah. Okay, so if anyone else comes up with any others, please do put them in chat. We'll add these into this slide and share it with you all afterwards. I'm going to bring John Paul in now, who's going to talk about some case studies and some examples.
Thank you, Russell. No, it's really, really useful, and I think taking this behaviour change challenge seriously, and ensuring that we focus on the right target audience, i.e. the senior decision makers, and consider all of these steps is really important. Sometimes we've got to apply our own methodology to our own internal communications, and that point around identifying these barriers and then communicating back. If you think about it in a way, we're at the sort of research and insight stage of this campaign, and so your input into the survey is really, really useful. Getting that indication of when people would like their budgets, not just in your organisation but in all of our organisations. There's some quite clear indication there, and then I think as well that justification. It's all well and good to say collaborate, but if at the last minute you don't make any space for it, it's going to be much harder. Negotiating space in council communications channels, there is a lot of competition. It's not that public health isn't important, but you negotiate better by being prepared sooner and asking first. And if you're asking for activity in autumn and winter, and you're asking for that pre-summer, your chances of success, chances of opportunities to collaborate are much greater. With cost of living communications, with active transport communications, with a whole range of different campaigns, these things will be always on and planned way in advance. So being able to integrate with those campaigns is really important. So I think it's understanding the behaviour that you want, having data that backs that up, but also giving people the why. And a really important part of why is, well, how did it work last year? And so hopefully as part of this group, you've got Russell helping you on the behaviour change challenge with internal stakeholders. And I'm sorry to say it, but frequently a third party, an external party, is listened to far better than we are in our own organisations. I know it's true in Cannes for me, but that's where I think we can really help each other out. Also, getting maybe third-party analysis or assessment of the impact of last year's campaign could be something that's quite interesting, that could start a conversation much sooner. And that's why we've invited our good friend Alex Waddington along. Alex has a really impressive history in policy development at the academic level, but is now also helping lots of public sector organisations use data, but really I would say more be selective about what data to use and how to weave that into stories that most people understand. Would that be an accurate description of what you do, Alex?
Yeah, that's it, JP.
Good. Okay. And one idea is to maybe offer the services, of Alex and Russell combined to go and engage your senior decision makers around what worked well and what maybe could be improved on. What are the gaps in terms of either data or resources or some of the problems around timing, and to feed this information back to them as an external report, and then to help define the behaviours and remove any barriers that they might have to the behaviours that we want to see. So, being part of this group, we'd like to offer that to all of you, and maybe start to think about it in the coming weeks and months as the year ends and the uncertain future is thought about, bringing in some concrete data, insight and evaluation into conversations now, with the recommendation that you're kind of getting your house in order in April and May, so that in June, July, you're giving certainty to the communicators so then they can radically improve the job that they do, not just in terms of spending money more efficiently, but also collaborating with the free channels that are out there. Council email, for example, the data around organic is pretty compelling. Let's not ask for that again. Let's ask for inclusion in council e-newsletters. Very powerful. We've actually got Sadie from eShop on the call as well. That's a much better ask. And maybe moving away from some of the channels that we know are a bit wasteful. There's a lot of complex behaviour change requests happening on the backs of buses, which might work for some things, but we can't see much correlation at the moment between those sorts of out-of-home opportunities and measurable outcomes. One thing I just wanted to show you that is another tangible source of data that you might be able to use to convince people is search advertising. If you've been listening to me at all over the past years, it's something that I really recommend using a lot. Now, one thing we can do for you is show you search data in your location. So at the moment, can I just check everyone can see this? Yep. This is data for England-wide, but we can zoom in on any specific location for you and then look at historic search data in that geography. So here we've looked at people searching for hospital, ambulance, accident emergency department, A&E, pharmacy, GP and GP surgery. And this tells us the kinds of volumes you get on a monthly basis. Now, we can see recently vast increases in searches around for pharmacy. Now, this, I suspect, is a result of some of the good work that you guys are doing in terms of promoting pharmacy as a route to care. But it also helps us understand at a local level what people are searching for and when. Now, this is useful for showing to senior managers what is on the minds of residents, and also maybe justifying why messaging needs to be of a certain form and maybe not of another form. And that's how we recommend using this data. But we can also zoom in on very specific terms. This, for example, this yellow line here is people searching for Calpol. And you can see here in March 2021, a huge spike in searches for Calpol, I believe, when there was a threatened shortage of it. We can zoom in on terms relating to baby temperature, things like that, to identify in any location what's on people's minds. You can look into cold and flu, look into things that we know trigger unnecessary trips to A&E, for example, asthenia, fever, and also examples of other things that maybe you do want people to go to A&E for. So this shows you certainly what's on people's minds and what people are thinking about. But then what you can do is you can intercept those searches with search advertising. So I'll just show you very quickly what I mean. If I'm typing in healthy temperature for a child, there could be an advert here nudging me towards, if you have a fever, if you're worried about child's temperature, here are the steps to take, self-care, staying at home, and various other things, basically routing people away from some of the more expensive, less efficient channels. So we can run that search advertising, and in some locations we are. So this is some activity that we're running across the 6 North East London boroughs, trying to intercept people typing in certain search terms and then nudging them towards signposting information that helps them either self-care or go to other locations. Now, this campaign's live and has been running throughout winter in North East London. But I just thought it might be worth showing you what you can see and what you get back. There's a lot, you can see here around mental health crisis, depression symptoms and things like that. So this is covering, yes, the pathways and the A&E demand, but also, the emerging pressures around anxiety and depression related potentially to the cost of living and so on. So this is an example of something that you could be positioning in front of the senior decision makers to say, well, look, if we start earlier, we can see what people typed in last year and what people were searching for, and we can develop plans with you now that will mean that that signage is in the right place at the right time for you. Also, as well, being able to work with local authorities, for example, to make use of, for example, in-house advertising. So around school term dates, you might want to be placing adverts for MMR and checking MMR status, or tips to self-care, around the winter period. All of these things can be done, again, if you're given enough time to do them. So I just wanted to share a couple of examples. We've got the expertise of Russell around behaviour change. We've then got the data and the insight around evaluation of what's been before. We've got some insight into what might be coming and some examples from other locations of what good could look like. And hopefully, setting up a conversation with your colleagues to suggest going through that process could be something, an intervention that triggers a new sort of behaviour. Does anyone have any questions about any of that? If not, great, and I will hand you back to Russell, who looks very still at the moment. I'm just wondering, are you still with us, Russell?
I am. I'm having a bit of an IT problem. Can you hear me?
Don't worry. Yeah, we can hear you fine.
Okay, I can't see anybody or see you, but I see you.
We can hear you fine. Go for it.
Yeah.
Could I just ask a question while we're
of course
waiting? So forgive me because I'm attending on behalf of my seniors who weren't able to attend today, and it might be that I don't know or that I wasn't paying sufficient attention. But who has access to that search data and by what means?
So we can, an ad agency, do, but I'm happy to do localized, so I could easily do that data for Cornwall and Isles of Scilly for you, and just to show you what's in there. If you buy a lot of search advertising in-house, you can sort of access that kind of thing through the Google buying platform. But this is something we subscribe to because it makes it a lot prettier.
That's what I understood. I wanted to make sure I had it right. Thank you.
If you'd like that, just drop me a line and let me know.
Okay, thank you.
Pleasure. There we go. There's Alex's details. If you're interested in sharing, and to be specific about that, we share a lot of the campaign data that we run with Alex, and if you have that sort of outcomes data, sharing it with him, sharing it with Russell is a great opportunity to then potentially benchmark different tactics against different locations, and I think that would be something again that would help you make the case. This is what we did here, here's our evaluation here, but also here's what's worked in other locations as well. We're more than happy, well, we'll get permission firstly from the organisations, but to share that data so that everyone else can see it. Our ambition is really to give you a really strong foundation that helps you change minds, if not hearts, as well. Russell, is there anything you'd like to add to that?
No, just really to thank everyone for coming. Thank you for doing the survey. If you haven't already, please do it. There are some good prizes on offer as well for one person who fills in the survey. please do reach out. You know, if like, you know, as was said, if we can help with this in any way, then yeah, please do reach out, and yeah, also let us know if you've got any ideas for topics that you'd like us to cover in another one of these sessions. Thank you, everyone.
We'll be in touch with the next date fairly shortly, right? Are
Oh,
we planning
yes,
in the
sorry.
next few weeks?
Yeah, sorry. Thank you for the prompt. So the next one is going to be on the 23rd of February, and we're going to be looking at mental health. So if anyone has any campaigns that you'd like to see featured or like to know a bit more about, again, let me know. But yeah, watch this space soon for the next session, which will be advertised on the 23rd of February.
Brilliant. Thank you so much for your time, Russell. It's always interesting, and yeah, look forward to seeing you then.
Thank you.
Thank you, everyone. Bye-bye.